In the studio now for this week's Your Health segment is Dr. Brajesh Lal, Associate Professor of Surgery at the University of Maryland School of Medicine and Vascular Surgeon at the University of Maryland Medical Center. Doctor, thank you for being with us.
Thank you for having me here.
Glad you're here. We want to talk about vein issues tonight. How prevalent is this?
This is actually much more common than one would have expected it to be. Close to about a third of all adults have some form of chronic venous disease in one form, shape, or the other.
We mentioned varicose veins, spider veins. Let's start there. What's the difference between those two things?
Well, these are a range of the same disease process. And one of the things that oftentimes we don't appreciate is the difference between arteries and veins. Arteries, as we all know, carry blood down to all the organs and your arms and legs and head and so on and so forth. And they have a distinct advantage over veins in that they have this little thing called the heart pumping blood for them to the organs. On the other hand, the veins have to carry blood back to the heart and the lungs to get purified. They don't have a heart at the other end. And they have developed valves, one-way valves, that when you're sitting or standing, prevent blood from pooling back once they've been squeezed forward. And it's weakness in these valves that results in blood pooling in your legs and causing varicose veins.
What is it? What's the force then that gets the blood from my feet back up to my heart? Is it still the action of the heart pumping through the arteries and then back up?
Well, to some extent the heart does help, but the main driver of blood in the veins are your calf muscles. And it's actually very simple. Every time you move your ankles, you're contracting your calf muscles and they're squeezing your veins, pushing the blood up. So it's a combination of the calf muscles and the valves that drives the blood up back to the heart.
That's why when people sit on airplanes for extended periods, they can have issues with that?
That's correct. In fact, any time that you're sitting or lying down for prolonged periods of time, you are at a higher risk for developing either varicose veins or, more importantly, clots within your veins also.
Well, we said at the beginning of the show that these issues aren't just cosmetic. Is a relatively normal, I can ask you how normal varicose veins are, but if somebody has that, do they necessarily have some more serious process going on?
Sure. So as your valves are weakening and as the pressure is building up continuously in your veins, you can transmit that pressure to your skin, and it leads to breakdown of skin, causing what we call as venous ulcers on the inner side of your ankles. And these, unlike ulcers that you get from trauma or from infection, are fairly difficult to treat. They can persist for weeks, months, sometimes even years. And the treatment involved once you've reached that stage of varicose veins is much more intense, much more cumbersome, and much more expensive.
Do we all get this as we get older, or are some people more susceptible?
I think our knowledge about this is limited, and we're still learning more and more about it. Clearly, varicose veins does run in families. On the other hand, professions where there's prolonged standing required also tend to develop these. So we know that there are some individuals that are at higher risk than others.
Okay, you talked about treatment. What can be done?
For the more early stages of this disease, walking, exercising, and compression therapy with elastic stockings is a good way to start. And most of the times you can control all your symptoms as well as progression of the disease with that. For those that have developed advanced reflux in varicose veins, eliminating the refluxing vein is the best way to treat that condition. And you can do that nowadays with minimally invasive procedures.
I didn't hear you talk about medication, though. Are there any medications that help?
Unfortunately, this is an anatomical problem. And therefore, we haven't really come up with the magic pill that can solve that.
When you talk about the leaky valves and minimally invasive procedures, are you fixing the valve, or eliminating that whole section of vein?
Unfortunately, we have not been able to figure out a good and reliable way of fixing those very fine, very small valves. So the only way that we can fix the reflux is to eliminate that vein or close that vein using either laser or radio frequency.
And then what happens? I mean, I think about the blood pooling as being one cause of this. If you take out one of the routes for the blood to get back, does that make it more difficult for the veins that are left?
This is where actually we're using anatomy in our favor. So we were born with a relatively restricted number of major arterial channels that take blood to the organs, but we have a ton of veins that can return blood. So as long as you can eliminate or close a refluxing vein segment, the other veins will take over.
What can we do in terms of prevention?
The clear methods of prevention are continually exercising your lower extremities. That's where these occur most commonly. And for those that are in professions where they are at higher risk of developing them, compression stockings.
So as a surgeon, you'll be standing for long periods in an operating room. Do you see people in your profession taking these sort of preventative measures?
Unfortunately, awareness exists. However, implementation of the recommendations is still something that is far short of what I would desire. I personally almost insist that everybody in my operating room wear these.
Let's focus in on the deep vein thrombosis issue that some people have when flying. I've heard of exercises that you can do, maybe the stockings. What do you recommend on a long flight?
So I would like to actually lump together long car rides, something that we don't talk about often and take for granted. So long car rides, long airplane flights, somewhat similar in terms of the risk of blood pooling, stagnating, and therefore forming clots. It's sort of a simple extension of logic. And if you can keep your ankles moving, contracting those calf muscles, if you can hydrate yourself well, wear compression stockings, and ideally every hour get up and walk, and you will be able to prevent deep vein thrombosis.
When deep vein thrombosis happens, how dangerous is that?
So deep vein thrombosis is essentially clots forming in the veins of your legs. The biggest risk is that a piece of that clot may dislodge and travel with flowing blood into your lungs. That's when it becomes either life-threatening or fatal.
That's a pulmonary embolism?
That is correct. That's
watched enough medical TV shows. Mm-hmm. Let's talk to Ellen in Preston County, West Virginia. Ellen, thanks for the call. Go ahead. Hello, Ellen. Are you there?
I was calling. I have a puncture wound that won't heal, and I've been going to wound therapy for 6 months now. And every time they turn me loose twice now, it won't heal. It blisters up. And they wanted me to wear compression socks, and I'm allergic to them or something. They just made it blister up, and it was awful looking. I can't get it to heal.
Well, let's see if we can get you an answer. Please listen on the air, and thank you for calling. Any thoughts?
I think that there are a couple of things that I would recommend you go to your physician for. The first is to find out if you have any problems with your veins and if that is indeed the cause of that ulcer. And the second is that there are different brands and different material stockings available. So sometimes a switch in the material helps in sensitized skin.
It occurs to me we may have scared a lot of people tonight when we're talking about something that's fairly common and then talking about serious complications. How do we keep that in perspective?
I think that we are currently in a stage where there's not a tremendous amount of awareness about the consequences of chronic venous disease. And although my intention was not to scare anybody, it was most definitely to make individuals aware that it's not just as innocuous as a couple of spider veins that you could probably hide away.
Very good. Dr. Lal, so glad you could come by. We appreciate your time.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.